I've been in nursing education for the past 20 years and certainly witnessed significant changes through the years. But I guess here are a few considerations in terms of changing viewpoints, et cetera. So one is the integration of technology. I believe that has shifted nursing and other healthcare professions tremendously. So, for example, the use of high fidelity simulation, and that's simply these mannequins, in my day didn't do much of anything, hard plastic, but these newer mannequins can mimic human situations and human experiences. So, having these experiences for our students allow them to engage in patient care scenarios and the safe environment, really helping them to build the necessary clinical judgment skills that are essential for safe practice. Of course, online learning, virtual science labs are on the rise. The idea of competency based education is another big shift. So it's not more previous time spent in clinical class, really high focus. Now it's really on the demonstration of specific competencies. Are students gaining the learning they need as they move forward? And many programs actually tailor educational experiences to the individual student needs where they are. The other piece that's really front and center is interprofessional education. So over the last number of years, working with other members of the healthcare team is really beneficial. Learning alongside of each other, understanding roles, responsibilities as you get out into the healthcare world really helps to create great patient outcomes. I'd say the other couple of pieces is focus on holistic and patient-centered care. So, as I've been in education for about 20 years now, nursing curricula have expanded to include education and training on cultural competency, diversity, and inclusion, really to support the growing number of diverse patient populations that we serve. Mental health is a big thing. Wellness, like we talked about, self-care, nurses recognizing and incorporating self-care in the profession. This whole idea of lifelong learning is another huge emphasis. And as we know, healthcare continues to evolve and become more complex. So really, we've got to keep pace in order to provide safe, effective care to our patients. A couple of other points before I end, but just addressing generational differences is also really huge. So over the years, I believe nursing education had to adapt to the learning styles of younger generations who often prefer collaboration, hands-on, technology-rich experiences. So my day, 25 years ago, would no longer serve the students that we serve today. And I guess I'll end with really just a focus on ethics and social justice. Over the last decade, I mean, there's such a stronger focus on ethics in nursing education related to patient autonomy and social justice. Our world is very small and very connected, so it's really important that new nurses understand global health challenges, and nursing education is preparing nurses to work in these diverse environments.